Hello, this is Josh with Dream Body Clinic. Welcome to episode 7 of DBC Diaries. This episode, we had Ted Rice come for treatment. He's doing a lot of different treatments, different joints, other things, and he's earned it, you know. Ted has been a celebrity trainer. He works with a lot of high-level executives, getting their fitness dialed in, but he's been pretty hard on his body. So you're gonna see here how he came to us to do stem cell treatment to fix up those problem areas. You're gonna see the MRIs that we did, and he did a lot of them to go through all of those and get all of his treatments and get him healed. You can find out more about Ted if you wanna look at, it's the legendarylifeprogram.com. That's his website, a lot of great information there. And if you're looking for just the ultimate kind of private coaching, he's the man. So we'd recommend you take a look at that. And if you got more questions, anything else, watch this video, see what it's like to experience a Dream Body Clinic, how we help patients with mesenchymal stem cells. I'm Josh, happy to help.
Ya nos estamos preparando para ir por Ted. Afortunadamente el aeropuerto está a 20 minutos.
DBC Diaries Day 1. Ted's going to be greeted by one of our drivers here at the airport, and they will help him get one of the taxis to his hotel. Fortunately, we're not allowed to pick up patients at the airport. The taxis have like a weird agreement there. So our drivers will meet you there. They'll take care of your taxi and get you right to your hotel to get everything started. But that first day, it's really just arrive, rest, relax, go enjoy the beach. DBC Diaries Day 2. So today, Ted's going to come in and we're going to start with the MRIs and x-rays. So he had quite a few that he had to do there. So we're going to get him in for all of those. We've got a very close relationship with the lab we work with, so they always get our patients in their VIP style, even have a little special room for them while they're waiting, and he will get his scans done so we have good analysis. DBC Diaries Day 3.
Hola, Ted tiene su blood work hoy a las 8:30. Después de eso continuaremos con sus resonancias magnéticas.
No, como nada.
No.
Pero
Sorry.
quiero.
Okay.
So we are back at the lab again today. Ted has some more MRIs to do and x-rays. Just we were doing so many different body parts that we had to split it up because each MRI takes about 45 minutes and you have to stay perfectly still. Fortunately, Ted is a master with meditation, so he was able to breathe his way through that, no problem, but it's still not fun sitting there for a few hours on end. So we split it up this way, and this is another good point that there's no limit to the amount of treatments you can do in one day. We get asked that a lot. You could do every joint in your whole body if you wanted to. So you'll see that here. Thanks.
Limbo, could you get a still photo before I go in?
All right, DBC Diaries Day 4. Today is treatment day for Ted. For a lot of patients, this would actually be the day to go through, review, analyze, decide exactly what we're going to do. Ted, we already knew what we were going to do, so he came in and we reviewed all that with the doctor, which you'll see here. They explain everything, image by image. They go through his blood work, line by line, so he can understand exactly where his health is. Then he'll start with the IV treatment. We'll go through with that, get all the stem cells in him systemically, and then we start with the joints. And there's quite a few today, so you'll see that and all the different joints Ted got so we can get him feeling perfect.
Ahora es momento de que nuestro paciente Ted pase a consulta con el médico para que le den una interpretación detallada de sus MRIs.
Le interpretamos cada una de sus resonancias con la finalidad de que él sepa cómo se encuentra en este momento y qué es lo que está pasando dentro de su cuerpo.
So here we have the right knee, okay?
Okay.
And we have front view and side view from your knee. So I'm going to start with the front view. The white spots shows inflammation, okay, or arthritis. Here we have your kneecap or your patella, and we can see behind the patella we have some inflammation, okay? We can see like this area, it's closer to the meniscus.
Is that the medial side there?
No, this is the outside.
It's the outside. Interesting.
Exactly.
Okay.
Yeah. And well, we can see like inside the joint, we have inflammation. The cartilage is thinner in some areas. And you can see like the meniscus. They normally looks like a black triangles. And here we have some tears or partial tears. Okay. Then we can see like the inflammation, and this is closer to the ACL, the ligament, okay? The anterior cruciate ligament. So in the side view, we can confirm. So this is the outside from the right knee. So it's here.
Okay.
We can see like the front horn of the meniscus and the back horn of the meniscus. You can see like these white areas. That means some extrusion or protrusion from the meniscus. So here, this is the front horn and the back horn. Then,
This is my good knee. Better knee.
so here we have your kneecap, the inflammation behind, we have some fibrosis, and here we have the ACL, the
Okay.
ligament, and it's inflamed. And here we have the PCL, and looks normal, okay? So both of your ligaments are fine, just the ACL it's inflamed.
Okay.
And then we have the inside of your knee, and well, we can see the meniscus,
The triangles.
triangles, black, and here we just have some area. Just let me try with this. So you can see like this area, it's some like damage in your meniscus, okay?
Right.
So this is a right knee. So this is the inside and this is the outside, okay? The inflammation here behind the patella, it's important. your knee is probably on third degree of arthritis. There are 4 degrees. So normally for patients in 4th degree, sometimes we need to recommend a replacement because it's no cartilage in there. And well, the inflammation inside of the joint, it's important, okay? With this treatment, we have 50 million for the right knee and another 50 million for the left knee. I'm going to inject on the lateral side, and I'm going to use the ultrasound to find the best place for the injection. But the treatment is really easy, and we use 50 million, and they came in 2 milliliters of liquid, so it's not too much liquid or too much pressure for your knee. And the intention of the treatment is to heal the cartilage and to relieve the inflammation, and well, to improve the quality of the meniscus. Okay.
Do you see post MRIs, like
Yeah.
you see changes in the inflammation?
Yeah, of course. And if you want to repeat another MRI to compare the before and after, you need to wait at least 6 months.
6 months.
Because
Okay.
the stem cells need sometimes to heal and repair the damage. Okay. This is better than the right.
My left is better than the right?
So this is a really common thing. Actually, we see this all the time. People will come in, they say both knees hurt, or they'll say their right knee, is your right knee hurts more?
My left knee.
So all the time someone will say, hey, my left knee hurts more, but we'll do the MRIs and their right knee is worse.
Right.
Just like yours. And the problem is it's almost like your immune system giving up. Too much inflammation, too many problems. And that's actually why it's going to keep getting worse at a faster rate, because it's not signaling to your body that like, hey, this needs to be healed, this is inflamed. And so the stem cells, you might actually find out after treatment, it switches and the other knee starts hurting more, which isn't a bad thing. It's not fun to deal with, but the stem cells also send out cytokines which reprogram the immune system. So they're going to start signaling back to your body, hey, this is inflamed, this needs to be repaired. Well, that might cause some extra inflammation and pain temporarily, but it's also going to get it so it starts healing.
Okay, interesting. Got it.
So now it's the same. We have a front view and side view from your left knee. And well, we can see like the inflammation behind the
It's the
patella.
white, right?
Exactly, in this area. And we can see like the meniscus looks better than the right knee. We have some inflammation inside, but it's most on the lateral side. So I don't know if that makes sense with your symptoms, but the outside, it's a little more inflamed than the inside. Okay.
Interesting. Yeah.
Okay.
I would say my pain is more on the inside, if I had to say it,
And well, you can.
but I get swelling on the outside though. That's the thing.
And your collateral ligaments looks fine, but here the outside it's inflamed.
Okay.
So yeah, and well, the background of the meniscus looks better than the right knee. And remember, we always try to compensate. If you feel pain on the left side, you try to compensate with the right side, and then you can hurt the other side. So
My left leg is stronger. Interestingly, yeah. Well,
and well, we have some inflammation here, and well, we can see the meniscus looks better than the other knee. They are totally black, and we have some inflammation around. Okay.
right. Got it.
We have your hips. So here we have a cyst. This is like a bone. You can see it's like a cyst. Okay. In your right hip. And well, we can see like the right hip and the left hip. Okay. We have some inflammation here, 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 and here it's a little inflamed, but it's not too bad. Okay, so you still have enough cartilage. Well, the labrums looks fine.
Oh, that's good to know.
It's just like some inflammation. Okay, so both of your hips are probably on 2nd degree of arthritis.
Okay.
And the treatment, for the treatment, we normally do just one injection. So this is the right hip and this is the left hip. We normally numb, like here we have the muscles, the fat tissue, and the skin, right? So we put the lidocaine probably here into the fat tissue, closer to the muscles, to numb the area. And then I'm going to inject the stem cells here inside the joint, and we let the stem cells there, probably 80% of the liquid. We use 50 million of the stem cells, and we combine the stem cells with PRP. So we have 3 milliliters of liquid, and we inject probably 70 or 80% inside, and the rest we let the stem cells outside to heal the ligaments and tendons around the joint. Okay?
Okay.
So the treatment is not painful and takes probably 5 or 10 minutes each side. Okay? This is your lower back.
Okay.
This is your lower back. Here we have L5, L4, 3, 2, and 1. This is the right side and this is the left side. Here we can see part of your liver and your right kidney, okay? Here we have the psoas, the muscles. You can see like the difference, like this is a disc, another disc, this. So you can see the difference in the colors. That means degeneration or dehydrate disc, okay? So it's common, like aging could be like one of the most important factors.
How do you stop aging?
Well, the stem cells.
I'm just kidding. Yeah, it helps, right?
The most important in this view is to see if you have some scoliosis or some anatomical curvature or something. But in this case, your lower back looks fine. This is your cervical spine. Okay, this is C2, 3, 4, 5, 6, and 7. The big one is the C7, okay?
Okay.
Then the front view is the same thing. We don't have scoliosis, so the anatomy in this part, it's fine. And then we have the side view. On the side view, we can see like here, we normally have a curvature, like this. In this case, it's more straight than normal, but it's not too bad, okay? But you can see like here we have a bulging disc, and here we have another bulging disc. So we have some compression.
So there's 2 bulging discs.
Yeah. I think between C4 and C5, it's the most important, and between probably C6 and C7, okay? But to confirm the compression, we have this picture, these views. Okay. And well, you have some degeneration into the disc that it's, well, normal for your age. Okay. This is the disc, and here we have the spinal cordon and the root of the nerves. So here you can see like the compression in this area. And here is between C4 and C5. Okay? So it's the same thing like your lower back. So we have another 100 million for this treatment, and the intention for the treatment is to relieve inflammation in the bulging disc and to improve the quality of the ligaments, the tendons, and well, the cartilage, because you have some arthritis into the facet joints. The facet joints is where the bones make connection with the other bones. So between the bones we have some cartilage, and in your case it's inflamed. Okay? This is the left shoulder. And yeah, this worse than the right. So here it makes sense with the symptoms.
Right.
Looks like bone spurs.
Bone spurs.
Yeah. You have
Could those be blocking movement?
no.
No.
That can produce some pain, but the cause of the limitation or the pain in your shoulder is because you have like a severe degeneration
Of what? The cartilage?
cartilage, and well, in general the joint looks like probably 3rd to 4th degree of arthritis.
3 or 4?
3 or 4.
Got it.
And there
Okay.
are 4 degrees.
And so is this on the head of the humerus? Is
Yeah.
that where that is?
Exactly. It's right here. You can see like the labrum. And well, you also have some tendinosis. The supraspinatus, it's inflamed.
Mm-hmm.
But I think in general the joint like looks
Which is strange. We usually don't see like end-stage arthritis in shoulders. But
so you can see like everything around the bone. It's like some cracked or something.
So
So
see how this color here, and then at the edge.
Yeah, it looks funky.
It looks like you've been like playing football your whole life.
and well, this is the cause of the limitation because you don't have lubrication. You almost have no cartilage like inside. Okay, and this is the right shoulder. Here we also have some osteophytes or bone spurs, but here we have more cartilage. So you can see like the difference into the bone. Like here, it's everything like normal and soft, and well, the tissue it's better. We have more space bone on bone. We have some labrum issues, but not too bad.
It's not torn.
No.
Okay.
And you have some tendinosis in the supraspinatus and the subscapularis,
Okay.
but they're probably on first degree, the tendinosis
Okay.
and the labrum damage. In general, the joint is probably on second degree of arthritis. Okay, so it's better. We have a big chance to improve and heal the tendons, the cartilage, the ligaments, but sometimes we can have no improvements because the osteophytes or the bone spurs.
So they're pinching.
Exactly. So the recommendation is if in 6 months you feel like you can repeat an MRI and if everything looks better, but you still have some sensation, pain or something, you need to go like with an orthopedic surgeon. They need to remove the osteophytes and that's it. So here we have your feet. And we can see like the space between bone and bone, it's fine. We have no fractures. We have no new bones or bone spurs here. And I think in general, everything looks fine.
Okay. That's good.
So you say the right toe, the big toe and the right foot, it's inflamed or something.
Yeah.
So here we can see like it's fine, and I think it's a good news. So probably it's just like the soft tissue, and if it's just inflammation, we can help and it's easy. Okay. So for this treatment, we have 25 million for each side, and the injection it's probably here and here. Okay.
Y lo importante de tener estos registros es que cuando el paciente acude de nuevo, podemos hacer una comparación de cómo se encontraba antes del tratamiento y posterior al tratamiento.
So we have your hands. Well, the space between bone and bone, it's normal.
That's good.
We have enough cartilage. We have no fractures here. And the quality and the density of the bones looks fine. Okay, so it's probably the same thing, probably just inflammation or some the soft tissue. But I think the treatment today, we have 10 million for each finger. The best way to approach the stem cells is injecting here in your knuckles.
Okay.
The stem cells, and then the blood flow and the nerves and everything goes help to
They'll dissipate out from there.
Yeah.
Same thing. They'll just guide the
As you can see, that.
yeah.
That's crazy. It looks fine there, but
Yeah.
Yeah.
see,
That's not fun.
well, see, I had a boxing fracture here, and this used to be protruded way up, and actually, it's you can still feel it. You could tell the bone was broke at some point, but it's not nearly. It doesn't hurt anymore. Nothing. It just takes time.
From the stem cell injections. Nice.
Yeah.
And one question.
I did my wrist, and they still traveled to there, and that fixed that. Yeah.
Okay. Yeah. Thanks so much. Nobi, and you know what? It's so weird. The orthopedic surgeon didn't say, "Hey, let's get an MRI for your back. Hey, and here's the situation." I was doing physical therapy with someone who works with the Cirque du Soleil people in Orlando. It wasn't really that great.
Yeah, the tough part is, and this is kind of their trick, is they'll do the x-rays and those don't show any of the soft tissue.
Right.
And so they can even manipulate the angle because you're getting one angle with that x-ray. You're not like an MRI where you're getting all the cross sections.
Right.
So all you're seeing is the bone and the distance. It's like your hands, right? It's probably soft tissue. We didn't do MRIs, so we can't tell. Right? But on the knees and the back, like you saw, we can see every last little detail and the bones. It's the way it should be. But you can manipulate like the angle of the knee MRI so it looks like it's bone on bone. And you might be like second degree arthritis, but they take the right angle. It looks like you have
this MRI?
No, the x-ray.
Oh, the x-ray.
So a lot of orthopedic surgeons will do that. And you need surgery. Let's, like you said, sharpen that knife up. And
to their credit, nobody ever recommended surgery except for the neurosurgeon. He was like, yeah, well, I would want to operate on 2, potentially 3 of your discs, but I would need a better MRI. Apparently, I didn't get a good quality MRI. I didn't understand. It was strange. But I was like, well, how do I know if I really need this? He's like, and he had an MD, PhD. He published a bunch of research on this stuff. And he was like, well, you know when you know. And I was like, I'm out of here. I'm out of here.
And here you can see like this is an X-ray. You can see like the finger. Here it's normal and
here
we get the video. If you look at their pinky is not normal.
Yeah, and also my thumbs. Well, you probably can't tell because you have no reference, but my thumbs are bigger than they used to be, and this one I sprained it recently.
Okay. DBC Diaries Day 5. So today we will bid farewell to Ted, eagerly awaiting to see his results in the next 3 to 6 months. Take him to the airport with our drivers, drop him off, and get him on a safe trip home. We're really excited to see the progress with his healing and the regenerative power of the stem cells that we're able to give here at Dream Body Clinic. So stay tuned. We will do some follow-up with Ted in the next 3 to 6 months. You can also follow Ted on Instagram. Just look up Ted Rice, RYCE, and you'll find him there. And he's doing weekly updates on his progress. But just know, typically you won't see results right away. Usually around the 3 to 6 month mark, things just start feeling better. Some patients see results faster, and Ted will be documenting that and let you know how he's doing.